COVID-19 review and update. COVID-19 is a virus. It spreads primarily via droplet through coughing and sneezing. Signs and symptoms include fever, shortness of breath, fatigue, weakness, flu-like illness, and in the late stages, pneumonia. Definitely watch out for your elderly and nursing home patients. That's where we're seeing clusters of the disease. Recently, nausea, vomiting, diarrhea, they were also added as symptoms of COVID-19 as well. It has an incubation period of about 2 to 14 days. So that's why you're seeing people go into quarantine for 14 days, because you may not have a fever on day 13, but you could on day 14 and then test positive. So that's why there's a 14-day waiting period, if you will, or quarantine period, if you've been exposed to a positive COVID-19 patient. Ways to protect yourself and your family at home. Practice social distancing. I'm sure you see it all over the news. Limit your activities when you're not at work. Monitor yourself for fever and signs or symptoms of illness. Don't report to work ill, please. Just let us know. We'll give you the time off that you need. Also, keep your hands clean. Hand hygiene has been listed as the #1 way to prevent you from catching COVID-19. The flu too, the seasonal flu, and really any viral or bacterial-based illness. Usually spread from people touching their face. The average person touches their face 15 times every hour, and they're doing it subconsciously. If you have an unprotected exposure, remember, an unprotected exposure only occurs when you had close contact, less than 6 feet away from a patient. You weren't wearing a mask, the patient wasn't wearing a mask, and you feel that the patient may have a contractable disease, a communicable disease, such as COVID-19, and you feel as though the patient may test positive for it in the near future. What you're going to do is, after the call, report it to the on-duty supervisor. Let them know that you feel that you had an unprotected exposure. You want to fill out the exposure packet in full. Make every effort to include the patient's name on the exposure form. That's the state form that we leave at the emergency room. This is so infection control at the emergency department can provide the director of infection control, which is me, information on the patient about whether they were positive or not for any communicable diseases. So far, up to this date today, we have not had any patients with any communicable diseases. So nothing's come back positive with all the unprotected exposures we've had so far. Doesn't mean it won't happen in the future, doesn't mean it can't, just means so far we have not. And please put the patient's name on the unprotected exposure form that you're leaving at the emergency room that you dropped off the patient. Without the name, it causes a delay in follow-up. They just have to call me, I've got to look up the run. It becomes a nightmare. So please make every effort to include the patient's name. Then fill out an incident report. Log into your team portal through the Trinity website. Let me know what PPE was used or not used for the call and why. This isn't to get you in trouble. This is to be open and honest about what occurred on the call and what we can do to prevent it from happening again. As you can imagine, we don't want to have unprotected exposures. We want you to come to work healthy, and we want you to leave work healthy and not bring anything home with you and threaten the health of your families. At this time, Sean Hunter will assess risk after you've had an unprotected exposure. Now there's low, medium, and high risk. For low risk exposures, which is difficult for me to describe in this PowerPoint, because only he understands it at this point and it changes constantly. But with low risk, you can still work. You can monitor yourself for symptoms. You don't go home. High risk, that's when you go home. That's when you get paid for the rest of your shift, you go home, and you potentially have a 14-day quarantine. But within those first couple of days, I work to get results on the patient to see if they had a communicable disease. And if they did not have a communicable disease, I relay that information back to you as quickly as possible and let you know and get you back to work and make sure that you and your family are healthy and safe. Sean's cell phone is listed here. It's an important phone call to make. Certainly call him if you have any questions whatsoever related to personal protective equipment. You may see that we have added a road on the road in the field EMT in the Lowell area. It's something we're trying out, 8 to 4 to midnight, and they are going on calls and assisting people with making decisions on when to put on PPE, how to doff and don it, putting it on, taking it off, just helping answer any questions you have, making sure that you are healthy and have safe practices out there in the field. Here are the current COVID-19 guidelines. These guidelines over the last 3 weeks have changed every single week. Minor adjustments are made pretty much on the fly, so that's why it is important to watch your email, because you may miss any changes. So at this time, for all medical calls, not just respiratory distress or shortness of breath, not just fever patients. We're talking chest pain, abdomen pain, unconscious, unresponsive, cardiac arrest, diabetics, all calls. A, always enter the scene wearing gloves, eye protection, and a surgical mask. That is the basic minimum. Then assess your patient. The criteria that you're asking for about is any respiratory symptoms, a fever, or have they been exposed to a COVID-19 patient? And remember, travel does not matter anymore. So that should not be a concern of yours whether they've traveled internationally or not, or traveled at all, because we are seeing outbreaks of the disease within the US everywhere, and especially close by in New York City, which is one of the biggest epicenters of the disease in the US at this time. If the patient has any one of those symptoms, have the patient wear a surgical mask. Now, we did go out and we purchased some makeshift surgical masks. They're blue. They're made out of porous, breathable surgical material that is water resistant, but you can breathe through it. It's the same stuff they wrap up autoclaved surgical equipment in. And you can place that on the patient. It is totally appropriate. This will prevent droplets from being spread should the patient cough or sneeze. Remember, COVID, once the virus gets into a person's body, most likely from hands to face, it has an incubation period of 2 to 14 days. And during that time, the virus is replicating and it is ramping up and it is settling in the nasopharynx, in the oropharynx, because it wants to be spread by coughing and sneezing. That's the primary way it is spread right now, through droplets when they cough and sneeze. And if you prevent them from doing those two things with a surgical mask, then you are good. You are safe. Now, other guidelines. If the patient needs an aerosol generating procedure, such as nebulized medication, bag valve mask ventilation, and any airway maintenance whatsoever, full protection for you is required. Gloves, eye protection, N95 mask. Wear the N95 mask from beginning to end. That is going to provide you with the most protection during these high risk procedures. A gown as well. So Aerosol generating procedure, put on the extra protection, change your surgical mask out for an N95 mask. The Massachusetts statewide treatment protocols updated, made some changes. At this time during the state of emergency, the recommendations are holding off on nebulized treatments if you can. Consider epinephrine for the adult and children asthmatics in place of albuterol. You could also use the patient's own metered dose inhaler. Ask the patient to take the metered dose inhaler with them and use it. They do work for themselves and it's not going to put you at risk. Try to keep a distance of 6 feet whenever possible. If you've been out to any of the supermarkets, CVS, you'll see that everybody's taking tape and taping it to the floor every 6 feet. I can't even imagine being the person that has to do that. I would quit and go do something else if that was my job. But other things here. If you're going to be in the driver's compartment, remember clean PPE. You don't want to dirty up the driver's compartment. Have the exhaust fan in the patient compartment on. Turn the heat and AC in the driver's compartment on full blast. And when you're calling in your patch, remember, say isolation precautions in your entry note. Don't just go walking in with the patient and be like, hey, we're here. Let them know ahead of time so they can pre-plan your entry into their ER. Holy Family Methuen has more private rooms than Holy Family Haverhill campus does. Keep that in mind as well for point of entry. Other things, when you're doffing your PPE, I said earlier, in the patient's room, please remove it in the patient's room prior to cleaning your equipment and disinfecting your own equipment. Use clean PPE to clean and disinfect your equipment and clean the back of your ambulance. Next, interfacility transports of COVID positive patients is happening. We are doing these at the ALS and BLS levels. We saw one last Sunday. We took a COVID positive patient from Merrimack Valley, Haverhill, down to the Kearney. I think it's in Dorchester. I don't believe in my career that I've been to the Kearney. I think I've been doing this for 25 years and it's probably the only hospital in eastern Massachusetts that I have not been in. So I'll have to go there someday. But they are our designated receiving facility for Steward Hospital. They also want to call when you're 10 minutes out with your COVID positive patient. So they want you to give them a call and let them know you're 10 minutes out because there is point of entry for that patient. They want you to wait in the hallway, wait for registration. They want you to have security escort you up to the floor. I believe it's 5 South or something like that where the patient goes at the Kearney. For interfacility transports of COVID positive patients, if you are transporting those patients, it is appropriate for you to don on a N95 mask. You are going to be in close contact with that patient for a prolonged amount of time. Now, is it necessary? Reading the literature, not at this time, but if it makes you more comfortable and you are safer, then certainly wear an N95 for prolonged contact in the back of the ambulance with a COVID positive patient. I look at it this way. We know that patient is positive. We are transferring that patient out. Make sure the patient has a surgical mask on. I'm sure they will. The hospital will have already placed one, but feel free to throw on an N95 mask for your own protection. In the Lowell area, they may ship out patients campus to campus, so we may see them going between Lowell and Saints, especially to the ICUs eventually, or into Boston in the near future, but we have not seen that yet. Other changes related to the state of emergency. Just remember, overall, we are in a declared state of emergency, and during that time, the state tends to lighten up the regulations and flex them a bit to allow for changes in scope of practice, changes in standards of care, and a loosening of the regulatory belts around things like paramedics and EMTs working together, and try to increase staffing levels for the better of society. We are in a state of emergency, and as of such, someday we may see martial law declared. If that happens, even if it doesn't happen, with the self-quarantine, somebody may someday ask why you're out and about. And if you're on your way to work, make sure you have your company ID on you when going to or leaving from work, in case travel is affected by the state of emergency. You never know. So it's best to have your company ID with a picture on it. If you need one, let us know. HR will get you one. Again, keep up with your emails. Emergency protocols related to these changes are occurring. Keep up with your emails, please, please, please. And you may eventually see alternative hospital destinations, right? Tent hospital sites. They're being put up in other states. Massachusetts is considering them as well, and they will eventually be allowable as drop-offs for patients in the near future. We see this usually during storm waivers, right? They'll say, hey, you can drop off a patient at a shelter, makeshift shelter, but it has to be usually during a state of emergency.